You've all heard of scoliosis, but did you know that there are other types of spinal curvature? Today at the Bone Museum, we're going to take a look at kyphosis, also known as a hunchback, which is a forward curvature in the spine, unlike scoliosis, which is a sideways one. Now, there are a couple different types of kyphosis. Postural kyphosis, which comes from poor posture, Schumann's kyphosis, which comes from abnormal wedge-shaped vertebrae and develops in adolescence, or congenital kyphosis, which appears in childbirth. Kyphosis can also develop later in life due to injury, osteoporosis, or degenerative changes. And we have a spine with kyphosis here at the Bone Museum, so let's take a look at it today. This specimen likely shows degenerative kyphosis and is likely the result of arthritis and age-related vertebral collapse. As an individual gets older, bone density decreases, causing osteoporosis, and as discs wear down, it can cause something called compression fractures in the spine. Compression fractures occur when the spine can no longer sustain the weight of the individual due to the reduced bone density of the vertebrae, and the vertebrae can collapse in on itself. If you're enjoying this video so far, make sure to follow for more. We can see here wedge-shaped vertebrae where they are more narrow towards the front, which is indicative of compression fracture. Compression fractures can also be silent, meaning that the vertebrae will collapse without any noticeable pain, thus the individual will not know that it's happening. Also of note, the spine shows 4 completely fused vertebrae. Now, it is hard to show and see on camera, but the spine does show progressive osteoporosis, which could have led to vertebral collapse and kyphosis deformity. You can see here that the trabeculi are more porous than usual. Now, we can also tell that this is not from ankylosing spondylitis, as ankylosing spondylitis would affect majority of the lumbar region as well as the sacrum, but here the fusion is only limited to the upper lumbar.